Hello friends, welcome to a new question. 70-year-old woman with history of rheumatic mitral stenosis has an acute right-sided hemiplegia. 3 weeks later, she dies of complications of aspiration pneumonia. What are the three features shown here? See, she dies of aspiration pneumonia. There is right hemiplegia, that means there is stroke first. Okay, first there is stroke and the patient has rheumatic mitral stenosis. So here in the picture you can see the liquefactive necrosis which is seen. What would have happened during the next 3 months if the patient has survived? If the patient has survived, this tissue is, all the necrotic dead tissue is phagocytosed or engulfed by the phagocytosis by the macrophages. They are engulfed by the macrophages and this tissue is replaced by glial tissue, or astrocyte proliferation and enlargement occurs in this tissue. How does this lesion relates to patient's heart disease? See, here how does this patient's thing relates to patient's heart disease, right? So here there is first and foremost mitral stenosis. This mitral stenosis has given some emboli in the left heart. Okay, from left heart there is formation of emboli which will grow into the brain, and they have occluded some minor vessel in the brain, thus causing liquefactive necrosis. So thank you guys for watching.